Hello, I am Dr. Vikram Pavle. I am a senior orthopedic consultant at Apollo Hospital, Navi Mumbai. I am glad today I am able to speak to you about osteoarthritis of the knee. My special interest is in the joint replacement and revision surgeries and also in the sports medicine where we do ACL and the meniscus repairs. What is osteoarthritis of the knee? After age of 40, all the X-rays will show some wear and tear or the degenerative changes. And MRI might be showing them as early as 35 years of age. So we all are going to grow, and as the age advances, we will develop degenerative changes which is called as osteoarthritis. Or in a simple language, it is called as wear and tear in the knee. That is inevitable. What we really don't know is why somebody will manifest pain at the age of 50 years of age and will need a knee joint replacement, and why somebody up to the age of 80 will walk and will come to me saying that doctor, I can walk for half an hour and I still get some heaviness in the knee, but no painkiller I will need at all. What causes osteoarthritis of the knee or makes things worse? I think prevention is always better than cure. So we must try to lose some weight. If there is any trauma, then it will cause acceleration because of the post-traumatic arthritis, any previous surgeries in the knee, or if there is any neglected sports injury like ACL or the meniscus injury, that will cause damage to the knee. It is important we keep our weight under control. Other metabolic disease like gout, in which the serum uric acid is raised, can also lead to the early progression of the arthritis along with the ligament injuries. What exactly happens in the arthritis? I have got a specimen. So you can see this light blue structure, that is a cartilage. That is just like the enamel of the tooth or our hair, which protects the bone from the pain. But as the car tire wears up, like say because of repeated use, you can see there is some red spots developing where the cartilage has been lost. They cause severe pain and inflammation. If that happens initially, the treatment will be symptomatic, like you take analgesics like paracetamol and Ultracid. We don't particularly like anti-inflammatory medicines which can cause stomach upset and kidney problems. If you are young, we can try some knee preserving surgeries like making the knee straight. Of course, there are some injections also like steroid injection, lubricating oil injection, platelet-rich plasma and stem cell. But they don't give a lasting benefit to the knee. They might just prolong symptoms and prolong your surgery by a year or two at the most. When the cartilage is completely lost, you tend to walk awkwardly and then your gaits become unstable. You should not fall down. That is very common in senior citizens. Because of the falling down, the knees don't get fractured, but the hip gets fractured, and which is very bad. When the condition is that bad, and many patients ask me, doctor, when would you recommend a knee joint replacement surgery? I tell the patient, when you can't do your activities of daily life, like you can't walk for 5 to 7 minutes, climbing up and down the stair is very difficult, you should contemplate undergoing a knee replacement surgery. The surgery is very simple. It is not like a knee replacement, like a liver transplant. It's a misnomer. What we do is, this is blue is your own knee joint bone. We just make a cut over here and put this tray over here. And on this side, we just make 6 hexagonal cuts, which you can appreciate from this side. And then we just put this one here. It's just a 1 hour job done under tourniquet. And you get a relief of pain. Generally, you'll be able to walk from day 1, but with the help of a walker. By 3 months, you'll be really back to square one. You should be able to drive within 6 weeks. The life of a knee, because of this recent advances in designs, has increased up to almost 20-25 years. With this latest knee, you will be able to sit down and sit cross-legged. It should be taken as a last resort. Always prevention is better than cure. Keep your weight under control. Keep doing activities, exercise, vitamin D supplements, and hopefully your knee will last longer. I hope this you find is very helpful. Thanks for watching.